Good morning, Judy. Good morning. Do you mind if I call you Judy?
No, that'll be fine. Thank you. And can I
Oh,
call you Faye?
of course.
Okay,
I'm
great.
Faye and I sell Medicare plans. That's me. Very, very rarely do I say my entire name. I'll tell you a quick story about that. When I was first married and my husband was in law enforcement, I was only known to everyone as Norris's wife. So I didn't use my last name. So I've become accustomed of everybody calling me either Norris's wife or Faye. So please call me Faye. Thank
Okay,
you so
great.
much. Let me thank you, first of all, for allowing me to talk to you about Medicare benefits and which plans might fit you best. Um, We've already had our initial interview where we've conducted a needs analysis. What I've learned, and I'll repeat that just to make sure that I'm on the right track. I'll repeat that we have I've learned what I've learned from you is that you live in Polk County,
That's correct.
you currently have a Medicare plan that you don't feel serves your needs because you're diabetic.
That's correct.
So thank you so much. I'm glad I got that right. You know, sometimes I talk to people and I might take the wrong notes, but I also want to thank you for completing the form that I sent to you that includes the prescriptions you're taking and the doctors that you have. Thank you so very much. So based on that information, and based on the fact that you have a chronic illness, I found a program with United Healthcare, which is the plan that you said you wanted to be with United Healthcare. I'm hearing some static in the background, and I don't know if it's because we both have our mics open. When you're ready to speak, if you could just unmute yourself then. Okay, that's a lot better. Thank you. So I found a plan, and actually, for this year, United Healthcare has only one chronic plan, and it will fit the chronic disease that you have. So that's the plan that I've chosen to review with you this morning. Is that okay?
Yes, that's fine. That'll be fine. Thank you.
Okay, thank you so much. Thank you so much. So are you able to see my screen? It's the plan that I've emailed to you previously. Are you able to actually see my screen?
Yes, the summary of benefits 2025 is what it says.
Absolutely correct. Thank you. This is the chronic plan, and you'll notice right behind the name of the plan, which is UHC Complete Care Florida 14, it says HMO POS C SNP, and the C stands for chronic. It's a chronic special needs plan. The number of the plan is listed below that as well. Now, this particular plan has 4.5 stars that's rated by the Center for Medicare and Medicaid Services, CMS, 4.5 stars out of 5. And what does that mean for you? It means that the plan has stability. The plan has been rated by CMS because of the quality that's delivered through the plan to the people who are actually in the plan. Every plan has its own rating, and overall, this particular plan is 4.5 out of 5, which is above average. So that's a good thing to know. This is the plan that we're going to be talking about. I want you to remember the name of the plan because when we get to the enrollment, this is the plan that you're going to have. We're actually going to be looking at enrolling for an anticipated October 1 effective date. It's not up to me. We'll do the application when we've gone through the benefits as long as it works for you. But the application then electronically goes to United Healthcare. United Healthcare sends it to Medicare, and Medicare is the entity that has the last say, the last stamp that can stamp on your application that yes, this is the plan you're going to have for October 1. Is that okay?
That's fine. Yes, that's fine.
Okay, so let's go through the summary of benefits. And if you have questions as I'm going through the summary of benefits, please stop and ask me. I want you to clearly understand the benefits. I don't expect you to remember everything, but that's why you have a copy that's been emailed to you. And you're also going to get this and an evidence of coverage book directly from the plan. So we can enroll for an expected October 1 date because of your chronic illness. The plan has no monthly premium. So what that means is you're not going to pay a premium to United Healthcare. There is a Part B. Remember Part A and Part B. Part A, you have no contribution that you make because you work more than 40 quarters. Part B, of course, does have a premium every year. And for 2025, that's $185. Well, you're going to get $17 of that back in your Social Security check. You will not get a check from United Healthcare. Your Social Security check will be adjusted by that $17. So you'll see a $17 increase. And that's because the plan is paying that $17 to Medicare. There's no medical deductible for this plan, so that means that effective October 1, when the plan starts, then you have no deductible. You can enjoy the covered medical expenses right away. There is a maximum out of pocket for all of the copays and the coinsurances that you have in the plan. And for 2025, that's $2,900. So between October 1st and December 31st, the $2,900 is the most that you will pay out of pocket for covered medical expenses. And that's important. It doesn't include prescription drug expenses, but for covered medical expenses, the most that you can pay. Now, had you started the plan in January, $2,900 might make sense. From October to December, that's going to be something really, really, really serious for you to have to pay that amount. But there is a limit on what you would spend for covered medical expenses. Hospital inpatient services often in plans are higher copays. And when I compare the current plan that you have versus this plan, in the current plan that you have, the inpatient hospital copay per day is greater than this particular plan, which is one of the reasons I feel this will work better for you. It's the United Healthcare, which is what you wanted. Your doctor is in network, and it helps you with controlling the chronic condition that you have because you have more hands-on care. So the inpatient hospital care is $150 a day for the first 4 days. So after that, you have no copays for inpatient hospital stays, and there's no limit to your medical stays. Now, for mental outpatient, you're going to see as we go through the plan, the copays are the same, except there is a limit on the number of days that you would be able to be covered in for mental inpatient stays. Ambulatory surgery can be either at the outpatient department of the hospital or at a freestanding ambulatory surgical center. Obviously, anything that's done as an ambulatory surgical procedure that's done at the freestanding facility will have a $50 less copay than if you did it at the hospital. You're going to find that, and you'll hear people say things like, the bigger the building, the bigger the copay. So just remember, if you're having something done at the hospital, it may cost you more than if you had it at a freestanding facility. Does that make sense, Judy?
That I understand. That sounds good. Very good.
Okay. So now, recently, plans have started to include observation. So this is when you're at the hospital, you're not admitted as a patient, but they keep you overnight. And this kind of started with COVID. So if that happens, you have $150 copay for observation services. Most important to you, because this is where you use most of your services from what you've told me, is your primary care doctor and your specialist. Your endocrinologist is extremely important to you because of your diabetes and your primary care doctor. And you felt you were spending a lot of money for your copays for the specialist. I think was your previous plan $40 or $50 each time you saw the specialist?
It
What
was
was that number?
It was 40. It was 40.
Okay, so now this is another reason why I'm suggesting this plan for you, because the specialist copay is half of what you were paying. The primary care doctor is zero, so you can see a primary. You can also see virtual visits with the telehealth providers that are in network, and those are zero. So you don't pay anything for primary, and your specialist is $20. Now, I just saved you money right away. You going shopping, I know it. So now let's look at your preventive services. All of the preventive services in any Medicare Advantage plan, which this is called Part C, are all of the plans that Medicare allows, and they're all at zero copay for you. So, to name a few of those, and one that might be really, really important, breast cancer screening, your mammograms are zero. Cardiovascular disease screening is something that you would need based on your diagnosis. Cervical and vaginal cancer screenings, colorectal cancer screenings, diabetes screenings and monitoring, all of those are zero for you. Um, Medicare diabetes prevention programs, excuse me, um, vaccines, including those for the flu, hepatitis B, pneumonia, or COVID-19, those are all zero copay for you. And because shingles is one of the preventive vaccines that currently are covered and recommended through the Department of Health and Human Services, those vaccines are also zero for this year. Emergency care, if you need the use of an emergency room inside or outside of the United States, you pay $140 copay for it inside the United States, but zero if you're outside of the United States and you need to use the emergency room. So the
That is
plan gives you worldwide.
fantastic.
Oh, well, great. You travel some, right?
I travel a lot, and that would be fantastic. Good to hear.
Oh, I'm so happy to hear that. So you understand, if you need emergency care, the plan will give you worldwide emergency care. The plan also gives you worldwide urgent care. So with urgent care, it would be a $60 copay in the United States and zero if you're outside of the United States. So there's another reason that we're going to use a plan that's going to help you and make you feel more comfortable about really getting your medical care delivered. Let's talk a little bit about diagnostic radiology services, lab services, diagnostic tests, and therapeutic radiology, which would also include outpatient x-rays. So let's start with x-rays. If you have an outpatient x-ray and it's not at the hospital, it's a $5 copay. If you have a therapeutic radiology treatment, it's a $60 copay. Diagnostic tests and procedures are $15. Lab services, whether they're done in your doctor's office or at Quest or LabCorp, are zero. Your mammograms, we had mentioned earlier, are zero copay, but other radiological services that are greater, like MRIs, CAT scans, PET scans, any of those scans, it's a $250 copay for you. Now we're going to get into some of the benefits that are not covered by original Medicare at all, except for certain situations. So hearing is one of those. Medicare will cover medical treatment of the ear or tissues of the ear because of a medical condition. It does not cover the exam or treatment for determining if you can hear. So we joke about it, but it appears that Medicare doesn't really care if we can hear. But it's just not one of the covered benefits unless it's medically necessary under original Medicare. However, in this plan, you have not only one routine hearing exam, it has to be a network. Now, you can't go out of network and just go get a hearing test at somebody that sends you a postcard or calls you on the phone and decide that the plan's going to pay for it. Doesn't work that way. You have to use the providers that are offered to you, but you have one routine hearing exam. And should you require hearing aids, you can get the hearing aids. There are two types. You can get over the counter or you can get prescription hearing aids, and the copays differ. So you could pay from $99 to $1,249, depending on which hearing aid you select or which works better for you. And you have access to more than 7,000 different locations to actually have the test and receive the hearing aids. At that point, Judy, some of my customers say, huh, what'd you say? What'd you say? Like they didn't hear me.
I do have a hearing problem, but I'm trying to listen well because that really piqued my interest. I was thinking about hearing aids. My doctor wanted me to go into them. I'm like, wait, I better wait the next year so I can get the full benefits. So that lets me know. So that works pretty good. I like that.
Oh, great, great, wonderful. I'm happy now. See, we're still finding those things that can help you.
Yes.
So, one of the other benefits that original Medicare does not cover is dental. So, this plan has preventive dental, which you can use in network or out of network. And that's why it's an HMO POS plan.
Okay.
HMO is a health maintenance organization, which means that all of your medical treatments, I need to make that clear to you, all of your medical treatments must be in network, and you go through your primary care doctor who coordinates all of those medical treatments. Dental, however, in the plan can be in network or out of network. There's no copay for two oral exams, for x-rays, for routine cleanings, and fluoride each year. So between October and December, you still have time to at least get one in. You won't be able to get two because they have to be 6 months apart.
Okay.
But you have access to the largest national dental network, and that's United Healthcare's PPO dental network. So you can see any dentist you like. Now, the difference would be if you use someone out of network, you may have to pay more or don't have exactly a zero copay because the plan is going to pay the out of network dentist the amount that they would have paid if the dentist was in network. Does that make
Okay.
sense?
That makes sense. So I need to make
But you,
sure if I can
oh,
which way so I'll know in advance.
okay, yes, you can. I mean, there are so many that are in network, and because you're in Polk County and you're not too far from me, I could recommend um, dentists that are in network. Actually, my dentist is in network, and he's in Winter Haven.
Great.
So another benefit that is not included in your original Medicare is vision services. So it seems that Medicare doesn't address hearing, dental, and vision. But this plan does. The United Healthcare plan that we're talking about actually has those three components within the plan. So, not a medical condition of the eye, but a routine eye exam for vision correction. You have no copay. If you have a medical condition, or an exam by an ophthalmologist to diagnose and treat conditions of your eye because you're diabetic, you have no copay as well. With the plan, with the vision correction component, you have $250 allowance for a pair of glasses that includes the lenses and the frames. You may
So
have
I got a
some
question.
small,
They don't treat the doctor as a specialist in this case?
if it's an ophthalmologist. But
Okay.
for your routine eye exam, remember you could get that at an optometrist.
Okay.
So, two different things here. For medical treatment for your particular condition, because you're diabetic, the chronic plan will allow treatment of diseases and conditions of the eye by the ophthalmologist, the medical doctor, the medical eye doctor, at a zero copay. You also have vision correction, which may not have any effect on your medical condition. It's just so that you can see better. You could do that through an optometrist and have zero copay for one exam per year for vision correction, and then have $250 towards your glasses. Does that clarify it for you?
Yes, it does. Then that helped a lot. I mean, like I said, with the current plan I had to pay $45 or $40 copay just to see my ophthalmologist. So that's good to know.
Right. Your specialist would have been that you would have paid the specialist copay. You're
Okay.
absolutely right. Oh, I'm
Mhm.
glad it's making sense to you. So
Yes.
now remember earlier I told you about the inpatient hospital stays for mental health. So you'll see here that there is a 90-day limit for inpatient mental health services. Now, there are also outpatient mental health services that include group therapies and individual therapies or virtual visits. So your copay, depending on where the therapy visits are delivered, could be from $0 to $15 to $25 if you're doing individual therapies. For skilled nursing, the first 20 days that you're in skilled nursing, and there's no pre-hospital admission necessary in these plans as it is with
Okay.
original Medicare. The first 20 days you have no copay. Remember, however, you still need to be in network. If you choose a skilled nursing facility that's out of network, every day the full cost will be coming out of your pocket. So if skilled nursing is required, you're going to use the same prudence that you would for any of your other medical expenses to ask the question, are you in network with, and name the full name of the plan. It's not, do you take United Healthcare? Because yes, they may take United Healthcare, but not this plan. So you always have to ask the question using the name of your plan when you want to know. And then if
Okay.
you're not sure or you can't get a straight answer, because people at those facilities are busy with taking care of patients, you can always call the customer service number on the back of your United Healthcare card, or you can always reach out to me. Just text me or call me. Now, after those first 20 days, you have $203 copay for a maximum of 100 days. 100 days is the max that Medicare will allow in any plans. So if you're going to be in skilled nursing longer than 100 days, now you're at the point where you have to make some arrangements to pay.
Gotcha.
If you need physical therapy, occupational therapy, speech therapy, language therapy, those copays are $20 per visit, and virtual visits for those same benefits would be zero. If by chance an ambulance is required to service you, it doesn't matter if the ambulance is by ground or by air, your copay is $275. There's no routine transportation included in this particular plan. For chemotherapy or any other Part B drugs, those would be injectables that are done either in a medical setting or by your primary care doctor or some other specialist. Those all have a 20% coinsurance. Your insulins have a maximum of $35 per month. And some of the insulins that you're taking are going to be covered through the prescription drug plan as a tier 3, one in particular, but we'll get to the prescriptions in a moment. I
Okay.
know that those are important to you, and you've already told me that you do take an insulin. In fact, here we are, we're at the prescription drugs. So there are several tiers in the prescription drugs, and starting with tier 1 and tier 2. Tier 1 and tier 2 are preferred generics and generics, just standard generics.
Okay.
Your best way to utilize the plan is to use the preferred mail order, and that's going to be Optum RX. Optum RX has will give you 100-day supply of tier 1 and tier 2 drugs, and some of your pills are actually tier 1 and tier 2, and you get those with no out-of-pocket costs.
Okay.
For tier 3, the brand name drugs, you get a 100-day supply for $131 copay. And for covered insulin drugs, you get a 100-day supply for a $65 copay.
Okay.
Now, if you look across, that is the lowest. There's a $25 copay for your insulin in tier 3, but that's only a 30-day supply. So if you had to get it for 3 months, that's $75 versus $65 through the mail order.
Right.
So that's how your drugs are going to be delivered to you at home. And even though it's insulin and needs to be refrigerated, they ship it overnight. So you don't have to worry about it. You just have to kind of remember when you've ordered it to look out for it, because sometimes they'll drop it at your front door, but it's packed in ice. Just don't go away. Since you travel, don't go away for 2 or 3 days and leave it outside.
Right, right.
So if you spend a total in any of these copays from the tier 3s, if you spend a maximum of $2,000 for any covered drugs during October, November, December of this year, then you get into what's called the catastrophic coverage stage. And that's where for the remainder of 2025, you would pay no copays for covered drugs.
Okay.
Questions?
Nope, you answered them all. Yes.
Okay, there are some drugs that are covered at the tier 2 level that are not covered by Medicare Part D. They're not allowed to be Medicare drugs, but it may be something that you need, vitamin D, vitamin B12, folic acid may be something that your providers will prescribe, and you can get those through the plan. Chiropractic services, there's the $20 copay, the specialist copay, the diabetic management. And once you are enrolled in the plan and I have your number, I'm able to set you up with advanced diabetic supply, who will automatically contact your doctor, set up what it is that you need in terms of diabetic supplies, whether it be glucometer, the strips, or even if
Okay.
it's one of the what do they call those things that one of the Dexicom or one of those, whichever one your doctor prescribes, they will set it up so that it comes to you automatically and the refills are done before you run out.
And
So
there's no
that's
co-pays for that, right?
no copays at all
Awesome.
and no shipping costs either.
Awesome.
Durable medical equipment is 100% covered except for 20% for wheelchairs, oxygen, any other durable medical equipment. Also for prosthetic devices, it's a 20% coinsurance from you. But those things are covered in the plan. Now, in addition to that, you have the fitness program. It's not Silver Sneakers. It is actually a program. It's called Renew Active. And it's the same as Silver Sneakers. You go to the same facilities that everybody else who has Silver Sneakers, but United Healthcare owns Renew Active. So their program is Renew Active. You go in and they give you a fob. You can use any of the gyms. You don't have to use the same gym all the time. Podiatry services are $20 copay, the specialist copay, and you have 6 visits per year. If you're hospitalized or if you're in skilled nursing, you have 28 home delivered meals to you, sent to you once you're discharged from either the full service hospital or the inpatient skilled nursing facility.
So the meals that they send you, they give you like a menu, or they just select healthy foods and send to you? Which one is it?
No, because when they're ordered, they're going to know one, that you're diabetic. So
Okay.
they're going to be prepared based on what your condition is,
Okay.
and then they'll be delivered to you, and then you use them and eat them as you see fit.
Gotcha. Thank you.
Home health care is zero copay. Hospice is again where Medicare now steps in and takes over all of the hospice covered benefits. So that's outside of the plan. but the plan is still in effect. So if you need prescriptions, that's going to come from the plan, but your medical care will be taken care of by original Medicare. Opioid treatment and substance abuse disorders are covered in the plan, and the copays will vary. In this particular plan, you also have an over-the-counter and food credit benefit. It's $48 every month that you can pay for your over-the-counter benefits, as well as choose healthy foods like fruits, vegetables, meat, seafood, dairy products, and water. There are a number of places where you can get and use your U card. You're only going to have one card. It's called the U card. And that one card you will use for all of your covered medical expenses, all of your prescription drug expenses, your vision, your dental, your hearing, and your over the counter and healthy foods. Walmart seems to do very, very well because you can get the food there as well as the over the counter. You can also,
So, because I like to go to Publix, so I can't go to Publix with this card.
you can go to Publix, but Publix prices are going to be greater,
I got you.
and you
Okay,
have to arrange to get the most you can with the $48 you have. So
got you.
I suggest Walgreens if you're going to do the food. I mean, I'm sorry, Walmart if you're going to do the food, but yes, you can use it at other places. I noticed that CVS isn't listed here, but it says your neighborhood stores. So that would include Publix and CVS.
Okay.
And I use CVS personally because CVS is closest. It's really right across the street from Walgreens. You know what that is. Once
Yes.
Walgreens is there, CVS is across the street.
So
But
true.
CVS has it all of the over-counter things all lined up in special rows. They have them on the other shelves as well, but then you have to look through everything to find what you want. But CVS has a special section that has only over-the-counter products. So it just
Okay.
makes it easier for me. I don't know. So for renal dialysis, it's a 20% coinsurance as well. What questions do you have?
You went over quite a few of the things that I was looking into, especially with the diabetes and the medication. Uh, Thinking about putting me on Ozempic, which that wasn't one of the ones that we talked about, but that was still a different medication. So it's looked like it's going to fit me perfect because I was paying quite a bit amount of money for my medication in the other plan and my all the doctor visits with most of my specialists. So that works out great.
Actually, let me just share with you that Ozempic is covered in this particular plan. It is a tier 3 drug.
Hmm.
Because it's a chronic plan, there's no deductible for it. So you would start to order it from Optum RX through the mail order and $65 for a 90-day supply.
Oh, that's awesome. That's real awesome. I pay a lot
So
more than that.
So actually, if you will take out from me your Medicare card, your red, white, and blue card,
I
because
have it right here.
we've already gotten that information,
Yes.
but I want to make sure I have all of the correct information as we start the application. We're going to start the application. And
All
if
right.
you have any questions as we're going through that, please, anything that you think of, just let me know.
All right.
Okay?
Look. All right.